Good afternoon, everyone, and thank you for joining us today. My name is Lendy Ruano, and I am with Easter Seals of Southern California, and excited to be back supporting the Disability Tribe Initiative. Today's live webinar, Helping California Address the Direct Support Professional Workforce Crisis, will be offering Spanish and ASL interpretation. Next slide, please. Para las personas que necesitan o prefieren el español, usted puede acceder a este servicio haciendo clic en el icono con el globo blanco en la parte baja de su pantalla, que dice Interpretation. Después, haga clic en Spanish. Aquí tendrá la opción de silenciar el audio original y podrá escuchar la voz de Mark Gutiérrez traduciendo. En el canal de español, si selecciona Mute Original Audio, escuchará solamente al intérprete. Si no hace clic en Mute Original Audio, entonces escuchará a los presentadores de habla inglesa al fondo. Our ASL interpreter is Destiny Bradford. She has been spotlighted so she can always be seen throughout the presentation. Depending on your device, this may mean that sometimes you cannot see the interpreter, or the presenters, I'm sorry. We apologize for the inconvenience, but we want to make sure that this live presentation and recording can be accessible to everyone. This presentation will have closed captioning, which you can access by using the button at the bottom of the screen as well. Next slide, please. A few things to note about Zoom before we get started. This meeting is being recorded to allow us to refer back to the discussion today and the input we receive. You can hear and see us, but we cannot hear and see you. Everyone has been automatically put on mute and your camera is not on. Chat is not available for attendees. However, presenters will be sharing information throughout the webinar via chat. If you would like to ask a question or provide a comment, please use the Q&A feature at the bottom of your screen. We also ask that you indicate which presenter you would like to send the question to. We have staff monitoring and responding as necessary. Some questions will be answered in real time, or we may ask for your email address so we can follow up afterwards. Si necesita hacer preguntas o comentarios en español, lo puede hacer utilizando la caja que dice QIA en español. Tenemos personal bilingüe asistiendo. Finally, at the end of today's webinar, we will be asking you to participate in our post-event survey. Once the webinar is over, a new window will pop open with a survey. Please provide your feedback so we can improve on future events. And now, it is my pleasure to introduce Executive Director at California Disability Services Association, Barry Giardini, and Director of Person-Centered Services at Easter Seals Southern California, Amber Carey Navarrete. Amber, Barry?
Thank you, Lendy, for supporting our webinar's accessibility today and also getting us started. I would also like to thank all of you in attendance for joining us. I am pleased to announce that with the support of the Department of Developmental Services and the San Diego Regional Center, the Disability Thrive Initiative is back. There are a few small changes with the initiative this year, but our purpose remains the same, and that is to continue to bring you the information and tools you need for advancing services and supports for the IDD community. Our service landscape continues to evolve. For that reason, over the next few months, we will be offering a series of free webinars focused on enhancing services and support for people with disabilities and their families. We will also continue to follow our webinars with Lunch and Learns. These are where you have the opportunity to speak live to our expert panelists and others in the community as we navigate topics important to all of us. We are consistently adding to our already robust resource library with trainings and tools specifically tailored for California's IDD service system. This way, you can find the information you need whenever you need it at our website, www.disabilitythriveinitiative.org. We look forward to continuing to partner with service providers and other professionals, individuals using the California service system, and their families as you explore innovative and collaborative ways to deliver services in our wonderful community. Together, we truly can thrive. Speaking of Disability Thrive Initiative partners, it is my pleasure to reintroduce and thank our amazing and indispensable partners from the California Disability Services Association. And here with me today is their Executive Director, Barry Giardini. Take it away, Barry.
Thanks so much, Amber. Good afternoon and welcome to the rebirth of the Disability Thrive Initiative. As Amber said, we're so grateful to be back, grateful to the department and the San Diego Regional Center. The CDSA team is certainly grateful to the Easter Seals team for being great partners on this project. And we're excited to come back because we want to make sure we continue to be there for our community as we go through some significant systems changes. And today's webinar is going to hopefully get to one of the core issues facing the system, which is the direct support professional workforce crisis. Next slide, please. And in covering this topic, we want to make sure that we are highlighting the efforts of the department that they've recently announced, as well as talking through some of the benefits of the Direct Support Professional Workforce Survey. This is a survey that the department has launched, and they will be going through in great detail today, but ultimately it's about getting good information about our system, where we are, where we've been, and hopefully will inform where we're going as a system. So we have the Department of Developmental Services here today to present on the survey. We also will have a presenter from New York who can speak to their experience in using a staff stability survey, similar to the one that we're going to be using here in California. And then finally, we're going to have some presenters to talk about this from a provider's perspective who've gone through the survey, to give some practical tips and benefits of having participated in the DSP Workforce Survey. So without further ado, I'd like to introduce our first speaker today. And it is Pete Chervinka, the Chief of Data Analytics and Strategy from the Department of Developmental Services, to talk about the purpose of the DSP Workforce Survey. Pete, thanks so much for being here. The floor is yours.
Thank you, Barry, and thank you for the opportunity to be here, and thank you to our attendees for taking the time to be here today. Again, my name is Pete Chervinka. I am the Chief for Data Analytics and Strategy with the State Department of Developmental Services. We're excited to be here today to talk with you about the first significant statewide effort to collect information about direct support professionals. When I think about what it takes to get things done, I think about money, time, and people. Among these three, time and money have no purpose without people to use them. And all this to say, people are the most important aspect of everything that we do. Yet in our system for developmental services, the direct support professionals are not employed by the state or by the regional center. They are employed by service providers. We are making massive investments in rate increases, access and equity, performance and quality, and the workforce itself and its development in an ongoing way through training. The big question is whether what we are doing is making a difference. These direct support professionals are our frontline workers supporting individuals and families. The information collected through this effort about vacancies, turnover rates, the benefits that are offered, the languages that are spoken, and many other topics is invaluable in understanding through data where we are. We envision this collection effort to be annual every year after this year so that we can help understand the changes that we are seeing, both through the investments that we're doing, but also to guide them. But this effort is not just about the state. Service providers are completing the survey using their administrative data, human resources records, for example. Individual service provider information will be kept private. We expect that data for providers in defined geographic areas will be compiled together and be transparent and available to everyone. This will allow individual providers to compare how they are doing to their peers and to do so over time. And they will be able to access this data also to advocate for policy and funding adjustments if and when those are needed in a data-informed way. There is something for everyone in this effort, and we're glad to see the support of so many of you for this important ongoing effort. There also is an incentive for service providers to participate in this, which my colleague Leslie Morrison will describe later. Again, really appreciate folks taking the time today to hear what we're doing and why we're doing it and how it's going to be done, and most importantly, why it's important it should be done. In other words, how it will be used. Thanks very much.
I'm Leslie Morrison. I'm the Division Chief at the Office of Quality Assurance and Risk Management at the Department of Developmental Services. And it's my division that is organizing and launching this survey and will be responsible for the data collection and dissemination. So I'm going to spend just a few minutes describing the survey process to you. Next slide, please. Pete covered much of what I was going to cover, so I'll hit the highlights. We have launched the Direct Support Professional Data Collection Survey. It was launched statewide in the middle of May. The survey window closes at the end of June, so we're about 3 weeks in. The survey is directed at agencies that employ direct support professionals. We identified who those agencies were, and all of them have received an email invitation to participate in the survey. The survey instrument that we're using is the National Core Indicator Staff Stability Survey. It's a survey that's used nationally and is specifically targeting the DSP workforce working with individuals with IDD. Pete covered the reason why we're doing the survey. It really is to get quantitative information about factors that are impacting the DSP workforce, to be able to evaluate those factors and to develop and measure initiatives stemming from those. We've sent email invitations to nearly 5,000 agencies that we've identified as employing DSPs. Those include providers that provide in-home supports, residential supports, and non-residential supports. In order to be a participant in the survey, you have to have employed DSPs and been in business for at least 6 months, and you need to have been in business through December 31, 2021. The data we're collecting is only for calendar year 2021. Participation in the survey is voluntary, but for those agencies that do participate in the survey and send us a complete survey instrument, they will be getting an $8,000 incentive for their submission. Next slide, please. Pete's covered much of what's on this side, but really the importance of the DSP workforce to the individuals that we serve and the difficulties that this workforce has been facing for a number of years, but particularly the last couple of years with COVID. So we really want to have an understanding about all of the factors that are impacting the DSP workforce so that we can develop initiatives and measure the success of those initiatives over time. This quantitative data collection is really paramount for that. Next slide, please. The survey tool does define what a DSP is. I've highlighted here what how the survey defines it. It really is an individual whose main job responsibility is to provide support, help with skills development and supervision, and personal assistance to people with IDD. They have to be paid staff, and at least half of their time has to be directed to DSP services. And for the purpose of this survey, it's limited to full and part-time. It does not include people that are per diem or on call. Next slide, please. There's a long list of people who are not considered DSPs, and I just want to highlight a few. We are not collecting information about DSPs who are not funded through the regional center. Because this data is informing initiatives through the department, it's important for us to really look at the DSP workforce that is funded by the department. The other category I want to highlight is the fifth bullet here, clinically licensed or certified employees. This includes therapists, nurses, social workers, behavioral specialists. This workforce really is has received additional training, often additional education, additional certifications, and for that they are paid at a higher rate. And it really is a different workforce than the DSP workforce. So while some of these job categories may in fact perform some DSP duties, they are not seen as falling within the definition of a DSP. So we've gotten some questions about whether RBTs or BCBAs are included in a DSP, and they're not. They are recognized as a higher or a category of employee that's beyond the scope of the DSP. Next slide, please. These are the general topic areas that are covered in the survey. I'm not going to go through them, but as you walk through the survey, you'll be asked to answer questions in each of these categories. Includes information about your agency, payroll information, compensation, bonuses, benefits, information about retention and recruitment, frontline supervision, and the impact of COVID. I did see one of the questions early in the chat was about if you don't have information available about your DSP workforce, for example, what their race and ethnicity is, or whether they speak another language. All of those questions do have the option to say, don't know. So please answer the question and move on. Those survey questions do collect information that you don't have that information. Next next slide, please. How the survey is completed. Again, this survey is directed to provider organizations, not to DSPs directly. We're collecting quantifiable information from agencies that employ DSPs. You will get an email, or you should have gotten an email from HSRI. They're the organization that owns the survey. They operate an online portal that you will use to complete the survey. The link to that portal is in the email. That portal link is assigned directly to your organization. So if you click that online portal, it'll open up the survey link and we will know that it's your organization that is completing the survey. Again, it is asking for data from the calendar year 2021. The survey window closes on June 30th. So we invite you to start the survey now. It does collect a lot of information, some of which you may be required to go and get and come back and fill out the survey. The survey link is such that you can leave the survey, save your work, and come back to the survey and complete the survey. So you can do it that way, but the portal closes on June 30th. We're really encouraging participants. It's important that we get the data and that we get enough data to be reliable. So we really are encouraging agencies to participate in the survey. On the DDS website, we are keeping track of the number of responses we have received by regional center and are really hoping to see responses increasing over the course of the survey period. The results will be publicly available after we do data cleaning and aggregation. We are hoping to have publicly available results starting by the end of this calendar year. We've employed UC Davis to help us with some of the data analysis. We're anticipating publishing it in a dashboard style presentation, so you'll be able to sort the data by different fields. And again, we're hoping to start having some of that data available by the end of the year. As Pete said, your survey results will be kept confidential. DDS will be able to identify which agency completed the survey and your survey answers, but none of that will be published. The data that's published is aggregate data. Next slide, please. Again, want to emphasize there is an $8,000 incentive for each agency that is completing the survey. The agencies are to complete one survey for their entire agency. So if you provide in-home services and day program services, one survey per agency. You have to submit answers to every question to be eligible for the incentive, and you have to have your survey responses completed by June 30th. We will not be paying those incentives until after the survey window closes, and those incentives will be coming through the regional centers. If you have any questions about the survey or your participation in the survey, we have staff that are managing a website. You can get more information from the DSP Workforce webpage, and maybe we could put in the chat the email address to the Workforce Survey group. It is dspworkforce@dds.ca.gov. That's dspworkforce.dds.ca.gov. If you have any questions at all about the survey, please don't hesitate to email us. We'll get back to you within a day or two. Thank you so much, and please participate in the survey.
Thanks so much, Leslie and Pete, for giving us a little overview of the survey and what it's going to collect and kind of how it can be used. I can say that we're incredibly excited about this process because the system lacks this data, and I think we can derive a lot of benefit and just information that we don't have today. And so when you say, Leslie, everybody go do the survey, we're certainly encouraging that as well from our side, and hope that all of you on the webinar today will join us and be a voice to encourage others to participate as well, because we will be much better served if we have a very broad result to pull from, to get a really comprehensive look at the workforce impact around the state. With that, we want to certainly highlight what we think will be the benefits, but we also thought, let's go to an expert and someone who has actually lived with this survey. Leslie mentioned that this staff stability survey is using a national data set through the national core indicators. And so we've reached out to the state of New York, wanted to find a state that kind of had some similarities to California. And we're really excited to have a presentation today by Michael Searider, the president and CEO of the New York Alliance for Inclusion and Innovation. And Michael is going to walk us through in his presentation how the survey has been used in New York, what are some of the benefits and advocacy opportunities that have come from participation in the survey, and also then some systems change things that can be derived from the data and in terms of addressing issues like diversity, equity, and inclusion in our workforce, making sure that the policy perspectives that we are pursuing address some of those core fundamental challenges, really broader than our system, but certainly in our system as well. So without further ado, I will turn it over to the presentation by Michael Searider, and hope you all enjoy hearing from New York. Thanks.
Thank you very much. Really appreciate the opportunity to present. I am Michael Searider. I'm the president and CEO of the New York Alliance for Inclusion and Innovation. We are the largest statewide association representing providers of services to people with disabilities across the state of New York. We have just shy of about 150 provider organizations throughout our network. And as our name suggests, we kind of lean into that space of inclusion, opportunities to find, to support individuals to be fully included in their communities, and innovative ways to do that. So we have been involved actually with the NCI data collection now here in New York for a period of 3 years, 3 straight years, that's 2018 to 2020. And it is really, I think, a great opportunity that I would encourage you all to be considering as well here. It really helps us understand indeed where we are as a state, so to speak. And it's a great opportunity for us as a trade association, a provider association, to help individual provider organizations understand where they stand in relation to statewide averages or even regional averages on certain various topics. And the data has been particularly useful for us from an advocacy perspective, which is one of the main thrusts or main work areas where we engage pretty regularly. And I would suggest that there's an opportunity here for states like New York and California to be participating in surveys like this. We need additional states like California to participate so that we can have other comparables for things like demographics and size of our IDD programs and the expenditures within those programs. So let me cut to the chase, if you will, on the 2020 survey results for New York it was. That was about 73, almost 75% response rate in the most recent survey, with 223 provider organizations participating, representing about 55,000 direct support professionals. So let's jump right in there to a few of those things. Unsurprising to us, but it kind of reaffirms what we understand about our system, specifically about direct support professionals. We are predominantly a female orientation for direct support professionals in our workforce. I would think that that's likely to be something similar for California. Similarly, we have known for quite a long time that we have a higher disproportionate rate of people who are Black and Brown New Yorkers who are in the direct support professional job titles. Indeed, the data presents out very similarly there. And I want to touch on that point toward the end of the presentation on the larger picture of things around this. And then when we get to talking about the IDD services system and the delivery of services, we have the data related to vacancy and the vacancy rates within our provider organizations. As you can see, on a part-time basis, New York State has a higher higher vacancy rate in relation to part-time employees than the national average, and a higher vacancy rate for full-time employees than the national average. And that has been a focus of conversation with our state elected officials, with policymakers, with our state office for people with developmental disabilities on a pretty regular basis now. And as you'll see, I think speaking to the issue not just of retention, but recruitment as well, we see the demographics, if you will, of how this plays out for our direct support professional population of employees and the length of employment. 10% not making it to the 6-month mark, another 10% not making it to the 12-month mark, almost 20% making it somewhere between 12 and 24 months, another more than 10% making it 24 to 36 months, and then 47, almost 50%, lasting more than 36 months in the job. But this speaks to the challenges that we have around recruitment and retention of direct support professionals. And likewise, it informs a conversation that we're able to have again with policymakers about the impact that has on quality, the impact that has on the costs that provider organizations incur as they are constantly recruiting and recruiting new employees to do the work. We know that there are thousands of dollars associated with that every time we see turnover take place. So backing up a little bit, if you will, taking a step back into the bigger picture here, I think that there's an opportunity here for something larger than just the here and now about what we see taking place on a regular basis. And I think that really speaks to more of a societal trend that we see taking place across our country, and probably beyond that as well, about wanting to be more informed from a data perspective when it comes to decision making. And yet I think our IDD services sector is really far behind certainly those in other human services, as we see here in New York State, but even further behind that health and medical service delivery system. We are oftentimes kind of left on the sides of some of those conversations, and we need to become more part of those conversations on a regular basis. Excuse me, and I think that we can be doing that by investing, if you will, in a culture of data and not getting left behind, so that we can understand and know where we are right now, or where we'd like to think we are, and also to be able to understand that what our experience has been from that long-term trend analysis perspective, which I think I want to talk about a little bit further here. And as an example of that, in our direct support professional workforce crisis that has been a nationwide challenge, not just one specific to New York, we know, because we've been collecting that data now for several years, that the issue of the workforce crisis wasn't one that was introduced by the pandemic, by COVID-19, but instead was something that predated that, and it was simply exacerbated by the pandemic itself. And so we were able to understand that and have a greater conversation with policymakers, with elected officials, et cetera, about what that looks like and the impacts that it has had on our service delivery system through the COVID crisis. Similarly, we've been, again, collecting that same data, but it was also an opportunity for us to examine the impact that policy changes that were taking place here in New York in terms of phasing up to a $15 minimum wage for New Yorkers, which is essentially now almost essentially statewide in place, what the impacts of that have been on our service delivery sector. We know that 10 years ago, these were jobs. The direct support professional jobs were jobs that paid roughly in that neighborhood of about 150% of the minimum wage. And now over that period of time, we have seen an erosion of the job and the job compensation, but at the same time, we're seeing greater complexity in the services or in the aspects of actually doing the job and performing the job. I keep coming back to and hearkening back to advocacy. Indeed, is probably one of our hallmarks and one thing that we focus on pretty significantly here at the New York Alliance. And I think from a data perspective, and having been on the receiving end of some of that data in previous roles, on the receiving end of some of that advocacy in previous roles, data is a really important part of the advocacy conversation that's taking place. And others, frankly, have been doing this better than we have for a long time. For quite frankly, a long time, we were able to get along on passionate and compassionate stories about supporting individuals with disabilities and saying to lawmakers and policymakers, we do good things for people with disabilities, you need to fund our supports. Now we need to be able to, and we need to engage in that conversation in a more a data-oriented way. Sure, those stories still remain very valuable, but they are less the front and center. They're more the backup to, hey, we've got the data to prove this is what our experience has been over a period of years, and therefore there's a policy issue that really needs to be addressed. Let me give you an example with a story with an individual's experience, et cetera, et cetera. We've been also collecting our own data on a very regular basis, which is a little bit more updated than the NCI data, but the opportunity to confirm what we have been experiencing and been collecting in our own data collection efforts through the NCI efforts kind of adds credibility to the entire effort, and quite frankly, adds credibility to some of our survey, our individual survey data as well. And it's really been helping, I think these issues, particularly the collection of data, help to continue to advocate or help to continue to advance the efforts to try to change our system and modify our system in ways that are going to be beneficial in the long run. For example, we've been struggling as a community of people for recognition at a national level for the standard occupational code for direct support professionals. And data, this is another yet a tool and toolbox to be able to say, yes, these are the jobs, these are the job requirements, this is how much these individuals get paid, this is what the compensation looks like, this is what the turnover looks like, the vacancy rates, et cetera, and to be able to demonstrate that in a quantifiable way with other professions that enjoy a standard occupational code and making the case for that. And I would leave you with that last comment there of, data allows you to have an opportunity to get a seat at the table so that you don't end up on the menu itself. Lastly, thinking about this more from a systemic perspective and systemic change, I really honestly do believe that data is indeed key to that type of systemic change. If we're going to understand where we want to go, we need to understand where we are now and track that over a period of time. And sometimes data collection isn't as flashy or as sexy as it might end up showing in a longer term way, specifically in those short term times. But they start to tell a longer story about what's going on, what's taking place, and it gives us the opportunity to take a look back and compare different dynamics that are taking place. And even if we just think it's a good idea, we may also be kind of forced into some of these issues as well, or forced into some greater data collection as well, if we're going to be moving our system from the existing fee-for-service system that exists here in New York State into a managed care structure or value-based arrangements down the road. We're going to need to become much more data heavy to be able to participate meaningfully in that opportunity. Here's also an opportunity, I think, to demonstrate how to use data to demonstrate how we can shift our system from one that has grown up as a primarily compliance-based system, one that has put rules and regulations on top of one another to be able to assure quality, and moving that toward more of an outcome-based system, which is where we would really like to shift the system, especially as we feel the collective weight of all those rules and regulations and requirements now bearing down on the very things that they were put in place with the intent of trying to protect. And from an association perspective, I think this is one of the most exciting opportunities, actually. It informs what we like to refer to as a community of practice. Collecting data, sharing that data in a way, in a safe place, a safe environment for us to collectively learn from one another about what's working and what's not, and how do we kind of change the way in which we collectively do things so that it collectively improves the opportunities that we all want to make available to the individuals that we support. And lastly, I'd offer the opportunity to re-raise that issue of race and ethnicity, specifically in our direct support professional workforce, and enter that into the conversation about a larger systemic, a larger societal dialogue that we're continuing to have and continuing to wrestle with as a country about ingrained and implicit bias that is built into our systems. For a long time, I have believed that any of the jobs in what I would refer to as the caring professions, direct support professionals, and people who in childcare, people who support individuals who are elderly, etc. I thought for a while we had a societal problem with these jobs, and as I've watched more and more over the past, specifically for the past few years now, I believe that less and less that's about the jobs themselves, but maybe more about the people who do those jobs. And we understand that that is maybe indeed part of the systemic bias that we are dealing with as a system. And unless we do our part to try to address those issues from in our little corner of the world, so to speak, we can't expect those issues to simply go away. They're going to continue to impact our system, impact our ability to recruit and retain qualified individuals to support individuals with developmental disabilities that we all are committed to. And I guess I look at it as part of a larger opportunity to participate in the societal changes and challenges that we're wrestling with, and hopefully to make some progress. So I'll be available on Friday to help answer any questions that might arise from this presentation or from the panel, and I look forward to speaking with you all then.
I want to thank Michael for the great presentation, and I hope some of the experience that he shared from New York kind of will encourage providers throughout the state to participate in this California initiative, because it's clear that there has been a real tangible benefit to New York, and I'm sure that it actually has been a tangible benefit to individuals with developmental disabilities as well. I also want to let you know that although Michael couldn't be with us live today, he will be with us on Friday at the Lunch and Learn. His colleague Ryan Cox is here answering questions. So if you have any questions about how things went in New York, Ryan is available to take those through the Q&A. So feel free to ask those questions there. Now we're going to transition back to California. We're going East Coast back to the West Coast. And we are going to have a presentation by PathPoint, which is an organization that has participated in the DSP Workforce Survey. So we are joined today by Harry Brule, the president and CEO of PathPoint, as well as April Peterson, the human resources manager, to give us the practical experience of participating in the Workforce Survey, some tips, and just a little bit more information on their experience actually going through it. So Harry, April, thanks for being here today. Appreciate your perspective.
Thanks, Barry. Appreciate the opportunity to be here and present and be part of the DTI. Welcome back. Glad you're back. We enjoyed many of your sessions in the past. We are a big fan of the DSP survey. We helped out with the planning in 2020, and then we just finished our 2021. So we've now done it twice. In a moment, I'll turn it over to April to talk a little bit about what worked for us when we went through the survey. But why this is important is that for us, and probably many of you, DSPs are the most important part of fulfilling our mission on a daily basis. And we are struggling, as probably a lot of you are, with high turnover and with, especially since COVID, the inability to hire back in DSPs and have a full capacity of our staff. And so what we're interested in with the survey is getting real data to answer a lot of the questions that we haven't been able to answer. And through the work, we're learning about turnover, wages, tenure, demographics. And these are things that we can learn not only statewide, but when we do the survey for ourselves, we're gathering interesting information just for PathPoint. And then I think it's been stated pretty well, but I'll say it again, because to me, one of the most important things about this is being able to make the case at a statewide level about why DSPs are important, why there's a workforce crisis out there, and how vital it is that we address it. And a lot of times when we go and talk to our legislators or talk to people in the administration, we provide anecdotes and stories, which are great and they're important. The response we often get back is, okay, what a moving story. What's the data? How big is this problem overall? Is this just you? Is it just your story? How widespread is it? And that's what we're hoping this DSP Workforce Survey will do, is we'll be able to finally say, here's the data, just like we saw from New York. But as one of the questioners noted, we have a lot more DSPs here, and we can make a really neat case if we can get everyone to participate in this. So before I turn it over to April, maybe advance a slide, please. And I'll just give a little bit of background to give some context as she begins to speak. We're a service provider in 5 counties in Southern and Central California. We were founded in 1964 and have a budget around 29 million. We support close to 2,600 individuals overall, and about 2,000 of those are in our DD services. We also have a behavioral health and division and do some work with young people. And for our DD services, we provide a lot of employment services, independent living and supported living, and then what we call community integration services, and many of you would call day services. And then next slide, please. Some of just a few of the highlights that we have. We do a lot of work on assistive tech and just started a lending library. We have a resource guide, and I think that's one of the things we presented on in the last cycle of DTI. We're a big fan of Project Search. We have 14 Project Search sites across our service area, and we really prioritize flexibility and choice with things like self-determination, tailored day services, and alternative services. And with that, I'm going to turn it over to April, who was the one who really took the lead role in putting our response to the survey together, and who can give some lessons learned or lessons in progress about our experience. So April.
Thanks, Harry. Next slide. As Harry mentioned, my name is April Peterson, and I am the HR manager at PathPoint. As I completed this survey twice, I have some tips that I hope will be helpful for you. My first tip is to start early. We participated in a pilot survey last year, and so we had a good idea of what to expect this go around. And even with that knowledge, it still took me about 8 hours over the course of several days to collect all of the information. So I definitely recommend starting early if you haven't already. My second tip is to download the PDF. When you log into the survey website, you can download a complete file of the survey questions. The website is very easy to use, and it stores your responses as you go. But for me, I found it easier to work from the PDF and then enter my responses once I was done with everything. The reason for that is that some of the questions relate to each other, and it was easier for me to cross-reference them within the PDF rather than clicking through multiple pages on the website. And it also made it easier for my team to review all of the responses before submitting them. My third tip is to create a plan. Up front, I spent probably about 30 minutes reviewing the entire survey. And I used that time to read through all of the questions thoroughly, determine what reports I would need to pull, who else I would need to work with, and what clarifications I needed. The questions are pretty straightforward, but there were a few that I wasn't quite sure about. And so I identified those up front and contacted DDS to get clarity. My fourth tip is regarding data access. You'll want to make sure that you have that. Some of the questions will be very easy for you, like what regional centers do you work with? But others will require fairly extensive data collection. At PathPoint, we have an all-in-one HR information system for all of our payroll, HR, and benefits needs. So for us, with just a little bit of report building and Excel magic on my part, I was able to access most of the data myself. However, I know that a lot of organizations may outsource some or even all of these functions. And so you'll want to start early so that you have time to work with your outside business partners to get the data that you need. Also, depending on who is completing the survey for your organization, you may need to engage with other departments to access the data, which leads me to my last tip, which is teamwork. The survey asks questions about your general business operations, program operations, and human resources. So make it a team effort with your HR and program departments. For us, there was a fair amount of back and forth answering some of the questions. So just make sure you allow time for that collaboration to happen. Next slide. With that, I will say thank you for your time, and I hope that these tips were helpful. And I think I am passing it to Leslie for some follow-up comments.
I want to thank all of you who have put questions in the chat. I hope that we have answered some of those questions. A number of those questions do pertain to, if I don't have the answer, what do I do? Again, most of those questions, I think all of them have a do not know response. In order to get the incentive, you do not need to complete the entire survey. So please don't leave any questions blank. We do want you to get the survey. And as April emphasized, please start the survey early. We did a pilot with about 8 providers last year, and particularly for large providers, it does take a little bit of time to pull the information together. They had to work with multiple departments within their agency, so please allow for sufficient time. I also know that there are some questions here about whether your service line qualifies. Please don't hesitate to reach out to DDS at the address that I gave you, DSP Workforce at dds.ca.gov, to address those questions. The survey instrument also, as you answer the questions, does walk you through whether or not you are qualified. But if you have questions before even starting the survey, please don't hesitate to reach out to my team and we'll address them. And I guess I just want to say again, we really encourage everyone's participation. We are one of 27 states now that does the DSP Workforce Survey. We are the only state that is paying an incentive, and the incentive that we're paying, I think, is very generous, and that is because the value the department is really placing on the importance of us collecting this information and really encouraging your full participation. So please complete the survey. I know that you as a group have been surveyed plenty. I think there were some comments in the chat about the rate study and being surveyed around the rate study. We do appreciate that we keep coming back to you with more questions, more surveys to complete, but this one is really going to some of the heart of the matter, which is making sure that we have a vibrant workforce that's there to work with our population, and your responses are of importance to the department, which is the reason why we are paying the incentive that we're paying. I don't think I have any other closing remarks except to thank all of you in advance for your participation. Please spread the word. Let other providers that you know of, encourage them to complete the survey. If they have not received an email invitation from the department, have them reach out to the department, and we will make sure that an email invitation with a survey link is sent to them. We really want to, again, encourage as much participation as we can. And I don't have any other comments. Pete, do you have any closing remarks?
Thanks, Leslie. No, I don't. I just echo your encouragement to do this for all the reasons we've articulated, and appreciate the questions and the Q&A that have been coming through. I think we've done a pretty good job trying to stay on top of those. So if you didn't have your question or think you might have one that's not yet answered, please continue to put them in the Q&A. We really appreciate folks taking time to talk through this really important data collection, not just for state benefit, but for provider benefit as well. Being able, as others have said, to use data to support advocacy for needed change is incredibly powerful and increasingly necessary. So thank you.
Yes, thank you so much. Thank you, Leslie. Thank you, Pete. And thank you to all of our presenters here today. This is such an important topic. And as we were seeing coming through in the Q&A, everybody here definitely understands that there's immediate need here. And this is actually part of a long-term solution that we can, as Leslie said, spread the word and get people energized. And this is like a first step towards more advocacy to fix some of the systemic and societal issues around rates and wages and all the things that we've been talking about. With having the numbers to back up those stories, just to reiterate one more time, is so important to effective advocacy. So I encourage everybody to definitely keep reaching out if you have questions or need any support getting these surveys filled out. One of the things that you can do right now, if you do have more questions, or you just enjoyed this presentation and think you know others who may have questions, anyone is welcome at our Lunch and Learn this Friday at noon. It is not a webinar format, it is a meeting format. So we have live interaction with expert panelists, some of whom you saw today, or others from their organizations. In addition to that, we even have sought out a small provider who has also done the survey. So if you're a small provider and you were looking at some of these presentations thinking, well, how does this work for me? I don't have as large of an organization as maybe PathPoint or some of the others spoken about. Please still come to the Lunch and Learn. We'll have information there, people there who can answer these questions, and we can continue these really important conversations. You can simply go to lunchandlearn.disabilitythriveinitiative.org and register right now. We hope to see many of you there and hope to get lots of really good questions answered, as well as just a really robust conversation happening this Friday at noon. Next slide. We have also set the date and have registration available for our next webinar. Our next webinar will be on July 13th from 3 to 4, and this topic is on social recreation and camp services. These are services that we haven't seen the funding and resources and being able to get vended through regional centers for about a decade now, but these are back on the table. And I don't know about all of you, but everyone I know, including myself, if we ever had a time where we realized how important to all of us socialization and recreation and just that feeling of belonging and connecting with people, that as during the pandemic, that really brought to the forefront for all of us how important this is. And I think for many of us, we always knew how important this was for the IDD community. It is so exciting that there are now opportunities in this arena again. So we hope you will join us on Wednesday, July 13th from 3 to 4 for our next webinar. You can register there now at webinar.disabilitythriveinitiative.org. Next slide. We also, as I was mentioning earlier on, have our resource library that we are continuing to update with new material all the time. We hope you go check it out on our website, www.disabilitythriveinitiative.org. And you can also sign up to get our e-blasts or emails from us at signup.disabilitythriveinitiative.org. Next slide. So with that, I'd like to go ahead and turn it back over to Barry Giardini. Thank you, Barry.
Thanks, Amber. Just a final thank you to our presenters today from PathPoint, New York Alliance, and DDS. Everyone seems to be on the same page here about the importance of this topic. And I know it was a little bit technical for some of our audience today, but I hope that you can see the value and why it's so important to us to promote this as a prerogative for the system going forward. I also just want to thank everyone for coming back. Obviously, we had a little bit of a break from the first iteration of the Disability Thrive Initiative. That was, of course, more focused on alternative services. And we're hoping you'll stick with us through this next series of webinars where we're talking really and focusing on advancing services and supports for the IDD community, trying to push the system forward and make sure that we're meeting the needs of all the Californians with intellectual and developmental disabilities. So thank you for coming back. If you're new, please come back next time. We look forward to working with you and sharing with you all, and really appreciate this community that has been built. So with that, thank you to everyone today. Thank you to our interpreters, Destiny and Mark, and we will see you hopefully at the Lunch and Learn on Friday. Take care, everyone.